Hi everyone, welcome to my channel. This channel is called MP Digital. I'm a family nurse practitioner. First of all, I am going to ask you to like, comment, subscribe, hit the notification button, and share. So last time we stopped at hypertension. We were talking about hypertension, and I think I said I'm going to um, talk about beta blocker, next topic, in angina. So today I'm just gonna round up on medications for hypertension. Um, okay, so beta blocker is not a first line treatment for hypertension. However, it is used for heart failure. They use it to manage a patient with heart failure. There are important things I want you to know about beta blocker. They have two types, especially metoprolol. There are two types. They tend to use that more often. Two types. You have succinate, which is the extended release. They normally use that for heart failure, and then there is tartrate as well. So I just want you to be cautious when you use these medications. There are contraindications, especially beta blockers. It is used for migraine, MI, which is heart attack, people that had heart attack, arrhythmia, hyperthyroidism, to control the tachycardia that people tend to have when they have hyperthyroidism. Like I said, it's a preferred treatment post acute MI, but there are people you can't give that to. People with shock, septic shock, cardiogenic shock, all kinds of shock, because it's going to reduce the blood pressure, it's going to reduce the heart rate, it causes heart block, first degree heart block, and you don't want to give that to COPD. And when it comes to beta blocker, you have cardioselective and non-cardioselective. Now let's talk cardioselective and the differences. Cardioselectives are atenolol, metoprolol, and troprolol. Extended release, you're going to see SL near it. So these cardioselective beta blockers, they block beta 1 receptor in the heart. So sometimes you can give them that to COPD, but the best practice is to avoid this class entirely. Okay, you can give it because it only blocks beta 1 in the heart. It does not block beta 2 in the lungs. We're gonna dive in. Now you can give to glaucoma. People with glaucoma, you give them timolol, which is eye drop, to decrease the intraocular pressure in the eye. Okay, another is non-cardioselective beta blockers. These are propranolol, Indera, and Indera is immediate release, and Indera LA, which is long acting. These two, there are other ones, but these medications are contraindicated if the patient is COPD. Absolutely do not give, because it's going to cause bronchoconstriction. They will have bronchospasm, or they may have difficulty breathing. So do not give this medication in this class at all, this non-cardioselective, because it acts in the lungs. It blocks beta 1 in the heart, and it blocks beta 2 in the lungs. It's very dangerous. Don't give. Okay, emphysema, COPD, asthma, it causes bradycardia. Don't give it. It causes AV block. Okay, and depression. Patient coming with depression and they have hypertension, don't give beta blocker. Find another class. It causes fatigue in elderly. It causes erectile dysfunction. Like I said, it causes heart failure, but you can use it to treat people with heart failure because it's the first line treatment. It blunts blood sugar response, hypoglycemic response. Sometimes people have it. They have hypoglycemia, and you don't know they have hypoglycemia, and the blood glucose is low. So you want to be careful with this medication if the patient is diabetic. Okay, so now let's talk a little bit more. Do not give it to asthma. Like I said, is the first line treatment for MI. The patient is, they already have they had heart attack, myocardial infarction, you can use it for this patient. Do not stop abruptly. You have to titrate this medication, because if you stop it abruptly, it causes a serious adverse, I think it causes reflex tachycardia and severe hypertension. So do not stop abruptly. You have to titrate this medication, then stop it. Okay. They use propranolol for social anxiety as well, right? So initial dose or starting dose, like metoprolol succinate, the initial dose is 12.5. You can increase it to 25 q daily, then you can even max it to 200 depending on the patient presentation. Okay, another one is bisoprolol correct. I'm gonna refer you to JNC8 to get more information on this medication. All right, so I am going to talk about complications of hypertension. Like I said, people have long-standing hypertension, chronically elevated blood pressure. They don't know they have hypertension. It's not managed. Sometimes people have stroke. They can be paralyzed one side of the body depending on where it affected in the brain. So you have to be careful. Know your status, know your blood pressure, so you can control it. Most likely, if you take medication and do lifestyle modification, blood pressure will be lowered, and avert all those complications. So lifestyle modification is, like I said, this weight control, processed food, avoid processed foods, salty diets, exercise. Reduce stress is very important. It's hard to, it's easy to say, but it's really hard to do, but it's doable. It affects kidneys. Nephropathy causes retinopathy. Nephropathy means it affects the kidney function, because the heart and the kidney, they work together, right? It affects the eye. It causes retinopathy. AV nicking, like we said in the last video. MI, it causes heart failure. It causes heart attack. So you want to be very, very careful. Another thing I want to say is compliance. If your patient comes in and they're not taking their medication, ask them why they're not taking their medication. There could be a valid reason, and you can always change to a different class if you have to. There's something they call a Cone syndrome, increased blood pressure. That the patient comes in, they have elevated blood pressure and it's really, really high. They have chronic hypokalemia. You may want to walk them up for Cone syndrome. Every time the patient lab is recurrently they have low potassium. You wonder, why do they have low potassium? They are not on potassium. They are not on potassium wasting diuretics. They are not on any medication that could be wasting potassium, but they have low potassium all the time, and you keep replacing and it's not coming up. You may want to walk them up for Cone syndrome if they have hypertension. All right. Another thing that may cause hypertension is birth control medication, oral contraceptives. So you want to be very, very careful with that too. Steroids retains water, because it's edema, and make your blood pressure go up. Okay. What else do I want to talk to you about? Yes, if somebody's blood pressure is uncontrolled and they have it's uncontrolled, like 160, 170, 150. If they're on aspirin, please DC that. You want to avoid possibility of having intracranial hemorrhage. All right. So those are the important things I just want to point out. And NSAID, over-the-counter medication, aspirin, ibuprofen, all this medication, they have a way of increasing your blood pressure. So it's not good for the kidneys. So be very, very careful. They are the nephrotoxic medications, over-the-counter medications. They increase your blood pressure. So if you are on blood pressure medication or you have kidney disease, please avoid these medications, these classes of medication. NSAIDs, like Toradol, all this medication. If you can avoid them if you can. All right. So with that being said, I am going to move on, and I will see you in the next video. I'm going to talk about, there is acute condition that I want to talk about. You see this in urgent care. You can even see it in inpatient sometimes, especially in this climate that we're in right now. So feel free to send me emails, questions. I'm available to answer your questions. Text me, send me messages. Okay, I read your messages and I'm responding to them, and I will talk to you later. Thank you. Bye bye. Now, before I stop this video, please like, comment, share, subscribe, and come back for more. Thank you. Bye.